Hi, everyone. I'm Christina Gonzalez. I'm the executive producer of Politico's live events here in Europe, and I'd first just like to thank you guys so much for being here to support our journalism. And also, if you'll allow me just a quick second to thank our very hardworking team here at Politico for putting on this wonderful event over today and tomorrow. So thank you all very much. I have the pleasure of introducing our next segment. It's a branded session where we'll be discussing cancer healthcare system readiness, getting EU regulation and R&D on the same path. And this is a segment that is led and organized by Sanofi, and it features Olivier Nataf, who is the global head of oncology at Sanofi, and Antonella Cardone, who is the CEO of Cancer Patients Europe. And after that, we'll continue our discussion on beating cancer with our editorial team following this branded segment. And so I'd love to invite Olivier and Antonella up to the stage. Thank you so much.
Thank you very much, and good afternoon, because now it's afternoon, actually. So it's great to be here. I really want to thank the Politico team for organizing such a great event, and really also our team at Sanofi for the collaboration for this segment. It's a pleasure to be here. Hi, Antonella. So maybe we can go to the first slide. So really the topic today around improving health for patients and aligning with really R&D objectives for pharmaceutical companies, for biotechs, for academia, because clinical research is really the first piece, the first step for access for patients. And you will have an opportunity to read some information on this slide that is, I think, extremely interesting in terms of the opportunities and challenges that we have in Europe, as Europe is really losing ground, based on every type of survey and studies that we have on clinical research currently. Europe is losing ground, and specifically losing ground in early research, in early stage of clinical trial, and that is what we call phase 1. It's very often related to what also we call first in human, when basically patients are included in clinical trials, usually for dose-ranging studies or this kind of approaches, and it's losing ground specifically to Asia with the leadership of China. And so I think it's important to take this into account and realize that we should not, stand still and even look at China in a sort of patronizing way, because they are really evolving at a very rapid pace in the past 10 years, moving from what we called a sort of Me Too approach to an innovation approach. They are an innovative country when it comes to healthcare research, and actually in oncology specifically, 25% of any innovative drugs right now that is in research comes from China. So it's not only global pharmaceutical companies working with China, but it's also the local biotech, the local pharma industry in China that is bringing innovative drugs, and so Europe is losing ground. And so this is really something that we need to take into account, as we need to increase the flexibility in the start of clinical trials, increase the flexibility also in the regulatory environment, and evolve towards endpoints in clinical trials that are going to go beyond the grail overall survival. It is a very important endpoint, overall survival, but we need to look beyond for patients to have more access to quality drugs faster, and also taking into account things that matter to patients, such as quality of life, for example. Antonella, what do you think about this issue?
Well, thank you, Olivier, and I think that we can see on the slide that in Europe the number of phase 1 clinical trials declined from 19% to 14% in 10 years, between 2013 and 2023. And this is versus a global increase in clinical trials from 32 to 41%. So what does this mean for patients? This is so it's not just a data that is related to research. For patients, this means less access to innovative treatments. And for cancers such as pancreatic cancer, for instance, this is truly unbearable because often for patients, access to clinical trials is the only hope to a treatment. So in Europe, we really cannot miss the opportunity to be at the forefront of research. Because for patients, this means for certain kinds of cancer tumors, this means surviving a cancer diagnosis or dying. And so this is why we are calling for a better clinical trial ecosystem in Europe.
Now, thank you, Antonella. It is absolutely critical, and as you see also on the slide, you know, from a pharmaceutical industry standpoint, we are an industry contributing to the economy, but we're a special industry because we're contributing to science, clinical evolution, medicine, and we're supporting patients and healthcare system in delivering better life for patients. And what we need to understand when it comes to cancer, and if we want to improve the way we approach clinical trial, is that not all cancers are created equal. And this is true in terms of clinical practice, but it is also true in terms of research and clinical trials and the way we are going to approach measuring progress, endpoints again, because metastatic cancer should not have the same type of endpoint as early stage cancer, and because curing cancer is not going to be about the next Sanofi or industry drug in the metastatic stage. Curing cancer is going to be about a combination of early diagnosis and the right treatment at the right time for patient. And this is absolutely critical. So it is important to differentiate and associate endpoints, patient-driven endpoints, to the stage of the disease, to the type of tumor that you're trying to cure. And also what is going to be critical in Europe is continuing to improve our access to clinical trial by making sure that the reform and the CTR, EU CTR clinical trial regulation does not come as a hurdle for companies to start trials, to enroll patients, and decrease again the share of Europe in the participation of clinical trial. What is going to be finally critical, and the previous panel talked a little bit about this, is to solve the workforce crisis, and specifically when it comes to nurses. Nurses in oncology play an absolute critical role for patients in clinical practice, but also because very often they do research in oncology, right? And oncology research nurses are missing right now, and this is also what is going to make it difficult for European academia to start trial and to enroll patients and to support patients from research, because it is sometimes the first access to actually clinical practice as usual. Antonella, the floor is yours.
Well, considering that in Europe we have 3.7 new cancer cases every year, we had in 2021 1.2 million citizens dying because of cancer, and we still have 12 million Europeans living with cancer across Europe. So we believe that we need to shift the focus from survival to quality of life. So we needed to look into clinical trials to different endpoints. And for us, this is critical. We need to reflect then on the real needs of cancer patients beyond the medical treatment. We need to consider when assessing the innovation of a treatment also what it causes in terms of side effects, what it causes in terms of social, economic burden to the patient, but also to the society. So we need to look at a variety of needs that go together with the cancer patients.
Thank you for this. And so really, in conclusion, I hope you hear the dire need to align EU regulation and science and research and development. We need to improve our ability to have endpoints that correspond to the patient need, to the stage of research, to the type of tumor, that include some biological measures as much as clinical measures, but also quality of life and patient-oriented trials.
Well, from my side, I think that it is very important to continuing considering cancer a priority on the political agenda. We have started in Europe with the Cancer Mission and Europe's Beating Cancer Plan, but we have not concluded the work. And if we want to set the scene and set a sort of a template that could be used also for other diseases, we need to complete the work that has started. And for us, this is of critical importance.
Thank you.
Thank you.
I think we move on to the panel. Thank you.